Welcome to the Smiles Are Wild channel, brought to you by Pediatric Dental Associates and Orthodontics. My name is Amy Morgan. We will be bringing you fun and educational videos weekly to help you take better care of your child's oral health care needs at home and on the go. Make sure to subscribe and turn on notifications to see all of our new videos. And remember, it doesn't really matter how you take care of your teeth as long as you take care of them from the beginning. So over the weekend, I had a plethora of phone calls. I am actually our on-call emergency assistant. So if you call in when your child has a dental emergency, it's usually me that you're talking to first, and then I'm kind of the liaison to the dentist who are on call. So we had 3 pretty big ones this weekend, and I tend to see this, or I've seen this trend over the last, 8 years I've been doing the on-call, that when it starts to get warm outside, all the kids get back on their bikes, you're getting in the pool, you're getting, just doing different things outside, and we're not fully aware, of what we need to be doing if something was to happen, such as an accident. So number one, as an office as a whole, especially with sports, any kind of contact sports for sure, even sports that you may not think are considered contact sports, like baseball is not a contact sport, and softball, but you can totally get hit in the mouth with a bat or a ball or another player. So we recommend mouth guards for sports. You might also consider it when riding bikes, things like that, but just anything you think where your child's teeth or mouth could be involved, we do highly recommend that you get a mouth guard. You can buy mouth guards almost anywhere, a Walmart, maybe a Target. I know for sure Academy has them. We have them. Here we also can make custom ones to fit. So if you're interested in that, just give us a call. Let us know you're interested in a custom mouth guard. Insurances normally don't cover those, but we do make them. And if you have any questions about what specific mouth guard you should be using for your child, obviously we're here. We'll be happy to answer those questions. We would just love to have, them protected as much as they can. So let's say, for instance, that Johnny or Susie, I don't know why I always use these names that I don't really feel like everyone names their kids these anymore, but let's talk about what to do if something was to happen. So this weekend, I had a 2-year-old fall and literally crack the front of their front tooth. I had an 11-year-old crack one of their molars, one of their baby molars. And then I had like a 14-year-old completely horizontally break their front tooth. So all these things happen. These kids were on bikes. One was on a bike, one was on a scooter, and one was just getting up out of the pool. And as they came up, they hit their mouth. So all these things are things that are technically considered accidents, can't always technically be prevented, but they are things that happen. In all these cases, the parents knew to contact the dentist. They knew to call us, let us know what was going on. And all those things will tend to prolong the health of that tooth. So the 2 baby teeth that got cracked, we did end up having to extract those. And that is just because the nerves were exposed. And so eventually that tooth would end up getting an infection or causing a lot of pain. Also, there are, on the child who broke their permanent tooth horizontally, we just have to attach more material, things like that. But they will be dealing with that, until they're fully grown, and I'll go over those things. So today we're just going to talk about what to do if you have a dental emergency and what the difference is in a dental emergency and a situation that may just require an office visit. Dental emergencies can occur in all places, and it is wise to know how to respond in these situations to provide the best oral mouth care for your child. So there are 2 things that we get calls for. So there's a true dental emergency, which is the things I described just a few moments ago: cracked teeth, broken teeth, teeth that have come out of their mouth. So if they have a permanent tooth that has come out of their mouth completely, that's called an avulsed tooth. And those need to be seen immediately. Anytime their tooth fully comes out of their head, you need to definitely be contacting us. And the broken teeth can cause a lot of pain and sensitivity, and over time can actually cause infection. So We just want to make sure that you understand that those things are, swelling, pain, anything like that. You can call our emergency line. It's just our regular phone number, which is 479-582-0600. I do recommend you go ahead and put our number in your phone just in case you're in the middle of the emergency. You can just hit dentist and it'll get to us. We can only take emergency calls for patients who are considered existing patients. So it'd be patients who are of record who have been seen in our office at least one time. We will call you back within an hour, and we'll kind of just triage it over the phone, see if it's something we can just do like a Motrin or a Tylenol for, or see if they need to be seen. So this weekend, I had several other calls, but those 3 actually had to be seen. So we do always have dentists on call. And sometimes, depending on the situation, the dentist is going to say it can wait till Monday. Just know we always make the best call that we can by triage, and we'll go from there. So the other thing that we're going to get into more of the pain and everything like that, but I would say the most common phone call that we get with parents, I wouldn't say in a panic, but that seem concerned, are when a permanent tooth is coming in behind a baby tooth. So this is actually not considered technically an emergency, and it's actually common. It's not normal per se, but it is a common occurrence. And we want to make sure that we're seeing them in a timely manner, but it's not something where they have to be seen the next day. A lot of time, or the day of, or the next day. A lot of times we'll encourage you to have them start wiggling on their baby teeth to try to get them loose. And then after a couple of weeks, if they're not coming out, then we'll bring them in and try to get those baby teeth extracted so that the permanent teeth can come in. Then, that, like I said, that is one of the most common that seems to be more urgent on the parent side, which we understand the concern there. But as a dental office, and what we recommend, as far as our recommendations are, that's completely normal. And it is something that we would love to see them for, but it's not something they have to get in on the same day. So on other things that happen are chipped teeth. So there are different levels of a chipped tooth. So like I just told you earlier, the children with the cracked teeth, their cracks were literally on the front of their tooth. So you could see the nerve through the front of their tooth, or it was on the side of their tooth and it was all the way down vertically. And you could literally see the nerve. Now, just a chipped tooth where one little triangle piece of it comes off, you're not as far up on the tooth to be able to have exposed nerve as that would cause sensitivity or pain. So if we saw a picture of that, we might say, hey, we'll see them on Monday. We'll fix that up. Sometimes we don't, if they're on baby teeth, sometimes we don't even fix them. We just let it sit there. It just kind of depends on how big it is. Because sometimes it can be 1/10 of the tooth, and sometimes it can be 1/2 of the tooth. So the extent of the chip will determine what we want to do and how quickly we would bring them in. A small chip on a baby tooth, their enamel is really, really strong and it's difficult to chip. So it's not that it's any bigger deal, but it's just not a permanent tooth. So it may be delayed until Monday. We would instruct you to give medication, and we would talk to you about all the parameters that go in with that. Okay. A chipped permanent tooth, we always want to see your child, but it just does not always warrant an emergency unless the nerve is exposed or there is quite a lot of bleeding with that. So again, if you were to call me and say Johnny is 17 and he just chipped his front tooth, first thing I'm going to say is, can you send me a photo? You're going to send a photo, and we have a way to make that HIPAA compliant. So I would talk to you about that. And then we would assess that. So I would talk to the dentist. We would look at the tooth, see what's going on. A lot of times we need to see inside that tooth. And for these front teeth, they don't really have, it's not like a molar. You can't just see down in it. But if you get a photo of it from up underneath it or over the top of it, then we can see inside the tooth and we can kind of determine from that framework whether or not the nerve is exposed. Excuse me. Again, it's just kind of it's a case by case basis, which is why we offer the emergency line. Okay. When a nerve is exposed in a tooth, a great deal of pain and discomfort occurs. This is actually considered an emergency and should be dealt with right away. So they're not going to be able to eat and they're almost not going to be able to talk. If their nerve is exposed, they're going to say the wind and the air is hurting their teeth. That means that they're having some nerve exposure issues and they're having some extreme sensitivity to that. So that's another clue that you can look for to decide whether or not it's a true dental emergency or not. Then, there's also just general pain and swelling. So we get a lot of phone calls about that, that your child is having just pain with a back molar or a front tooth and it's been ongoing. And on those, normally we'll ask, is there any swelling or any visible signs of a cavity? And again, we'll triage you through that. And again, most of the time that can wait till Monday. If you call us and you let us know that the child is experiencing swelling with that tooth, it is going to be determined on the amount of swelling. So if they just have a little bit of puffy gums around the tooth, that could be from a cavity. It could be from not brushing correctly. It could be they got food stuck there, any of those things. If you start to see the gums swell and they're going into their face area, so their cheeks are looking puffy or their eye is starting to puff up, or, you start seeing swelling on the outside of the face, those are going to be more of the ones that we would consider a possible abscess or infection to that tooth. And so again, we would triage you through that. Do we need to put them on antibiotics? Do we need to send you to the hospital? Anything like that. If you were to call me and say, and we have had this happen, that your child has some untreated cavities, and they have untreated cavities, and their face is swollen like a really big knot in their jaw, or maybe their eye area is super puffy and maybe even starting to swell shut, we would definitely direct you to the emergency room, because as dentists, we cannot administer things like IV antibiotics or anything that would be injected through a syringe. And so we would like for a medical professional to make the call of how severe is this infection and what medications should be done for that, because we feel like an oral antibiotic in some of those moments is not going to work fast enough. So, when we get those phone calls, I always try to prep the parents and let them know that, we're sending you to the emergency room, but this is why. I don't like to send parents into a panic because it can sound kind of, serious at that point. And it is, but that's the reason why we can't really address it. Now, if it's during the week and we're open, we would look at them and we would try to decide what we need to do. Sometimes those get referred directly to the oral surgeon's office and we get those teeth taken out on the same day. It just all kind of depends. Most of the factors that I'm referring to in this particular talk are regarding anything that's happening after hours. So after hours or over the weekend. Let's see. Again, we're just going to go over this. A true dental emergency is when we get an avulsed permanent tooth. This is where a permanent tooth has been completely removed from the mouth. In this event, it is important to get this tooth treated as quickly as possible. The best way to try to save the tooth is to attempt to put it back in place until your child can see the dentist. So that's, one piece of it is if you're at a baseball game and your child gets hit in the mouth with the ball or the bat, and the permanent tooth comes completely out, you want to try to find the tooth and get it back into their mouth as quickly as possible. Okay, so there'll be a socket where the tooth came out and you literally just want to try to pop it back in there. And that gives it its best chance to survive. There are a lot of things that come along with all of that, and that there'll be some other dental work to have to be done. The lifetime of that tooth, will be determined by how quickly we can get it back in their mouth. All right. Again, going back to chipped teeth, specifically referring to permanent teeth, if they were to come in with a chipped permanent tooth and we had to repair it, and say they're 9, 10 years old, they're going to be dealing with that chipped tooth until they're an adult. So we won't do any kind of veneer or permanent solution for that tooth until they are fully grown, because it doesn't make sense to keep having them come back as they're growing and having to fix those things. But in some people's chip repair lasts them forever, and some it doesn't, and it will come off, recurring times throughout their childhood, and you keep having to come back in to get it put back on. And that's just a piece of it. It's just part, of the process. But we do try to talk to you about all that. I don't expect you to remember this for if your child chips their tooth that they're going to have to deal with it. But we talk you through that. We follow that too through the lifetime of their appointments while they're our patients, and we talk to you about what they need to do once they're fully grown. Let's see if there's anything else. One thing I do want to reiterate here, if we have any teachers watching, we're going into Teacher Appreciation Week, and we know that a lot of times teachers spend a lot of time with your children. So we want to make sure to encourage teachers that if a child is complaining of pain, or you see some slight swelling or anything like that, or if the child comes up and says, my tooth is hurting, that, you send a note home with mom or dad letting them know that the child did complain of pain. That way the mom kind of can know that during the day they were having pain, and then at night, if it was to come up again, they can see the progression of how bad that pain may or may not be getting. So as a teacher, we know you deal with a lot. We know you have a lot going on, but we just want to make sure that if you have a child that comes up and says that you do make the parent aware. And if you don't have time to do that, have them go to the school nurse, have them call mom or dad, and let them know. If they're older, you can say, hey, make sure you tell your mom or dad when you get home, because we want to make sure that they're that they feel comfortable coming to you with something, but we also want to make sure that the parent is also, or the caregiver is also being notified of that, so that they can know how often they've been complaining, so that they can make a judgment call of whether or not they need to call the dentist to get them put in. Again, thank you all for listening today. We really appreciate it. We look forward to seeing you next time. Thank you. Bye. Thank you so much for watching. Make sure to subscribe and go visit us on smilesarewild.com.